There's a fundamental debate that is taking place around HIV/AIDS in Haiti since the earthquake has taken place. And this debate has taken place in various contexts. It's taken place on the internet, in blogs. It's taken place in reporting that has come from the conference that took place in Vienna earlier this year on HIV/AIDS, the World AIDS Conference. And it's taken place around the issue of whether, in fact, the approach of this government in Haiti is a fitting one for dealing with HIV/AIDS, whether in fact the approach is the correct one and is one that is advancing the interests of those living with HIV/AIDS. The curious thing about the debate is that it is actually being pitched between two forces in HIV/AIDS in Haiti that have been great partners over the years and have done fantastic work over the years. The kind of work that has moved Haiti from a 7% occurrence rate of HIV in the population to the current rates of 2.2%, which is just an amazing record, and all of that having been done in the space of about 10 years. These two parties, crudely described as those that form the NGOs and the larger established support networks and the activist networks, the grassroots agencies, are in a debate about how the government is responding and how the world is responding to HIV/AIDS since the earthquake has taken place. And I'm going to try and just lay out the two fundamental arguments, which are both quite compelling in themselves, but they also speak to what is the reality of HIV in a nation that is a poor nation that depends so heavily on international support and international aid for its sustenance and for its continuation. On the one hand, there's the position that since the earthquake, a fundamental shift has had to take place, and it is that the crisis of the earthquake has created such abject conditions, living conditions, for all the people in the area like Port-au-Prince and its environs, that any medical facility, any medical agency, any agency that deals with health has to contend with the wide range of issues that are emerging. Of course, there are infectious diseases, but there are also injuries that are caused by the earthquake. There are also basic nutritional questions of people living and surviving those nutrition and issues. And then, of course, there's the issues of where people are living, the physical nature of their environment, where they live, where they sleep, the ability to get all the services that they need, emergency service, preventative services, and so on. The basic needs that we see in refugee camps the world over. These are pressing issues that have consumed and overwhelmed the entire medical structure of Haiti since the earthquake. And what has happened is that many of the very well organized NGOs and clinics and hospitals that have been working on HIV/AIDS have either been co-opted or been drawn into working with the government and working in these emergency situations because they have the facilities, they have the connections, and they have the staff to be able to deal with those areas. So organizations like JSQ and POSE and ForceRef and other organizations have been busy working on wider issues, not simply HIV/AIDS or tuberculosis issues, because of the immediate and pressing needs that overwhelm them in the country. But the difference is that there's a sense from these organizations, many of these organizations, that there needs to be a continuation of that kind of work. The philosophy is that in order to treat HIV/AIDS effectively, one has to look at it holistically, and that any benefit that will reach out to the larger population, that is people with HIV and those without HIV, in terms of nutrition, in terms of primary health care, in terms of prenatal and postnatal care, in terms of dealing with injuries, physical injuries and debilitating injuries. Any work that is done in those areas is going to benefit the people who are living with HIV, because it means that they will be in a larger health environment that is frankly more healthy and more supportive as things go along. Consequently, an organization like JSQ has expanded its role dramatically to include things like building a school for kids, to include building a rehabilitation center for people who have had major injuries, with orthopedic surgeons that are in the facility, and you know, developing a rape center to deal with rape victims, numerous other projects and numerous other facilities that have no direct bearing on HIV/AIDS, in the sense that the people who come to receive those services are not people living with the disease. And these expansions are changing, it seems, the focus on strictly HIV/AIDS treatment. Now, in that argument, the argument is that if that is not done, then the very conditions that help to perpetuate the advancement of HIV/AIDS would continue, simply because people will tend to fall into the cracks, people will tend to suffer because of larger health needs. And the thinking is basically that HIV/AIDS is not an isolated disease, it's a social disease, and it's a disease that is precipitated by things like poverty and the absence of services to the general needs of the individual. So this is one view, and the view is very compelling, and it's a view that was taken by Dr. Papp, who is the head of JSQ, who has made the case that this is a shift that needs to take place. It is read, however, by those on the other side of the argument as a kind of reneging on a commitment to an activist and a focused way of approaching HIV/AIDS in the country. So on the other hand, here's the other argument. The other argument is that if we somehow dilute the focus on HIV/AIDS, and if we then treat HIV/AIDS as just one of many illnesses, the unique nature of HIV/AIDS and its uniqueness lies in the fact that it is so heavily stigmatized. It is a disease that is caused by social issues, by sexual issues, and therefore it has a tremendous brand of negative feelings around it. And it's a disease in which we are just learning in the medical system to treat it fairly and to treat it effectively, just learning to use psychologists, just learning to use social workers in the work that needs to be done in it, and just learning to, even for nurses and doctors, to remove all the stigma and the anxiety about working in HIV/AIDS. And consequently, if we simply treat it as just one of the other diseases, then there will be a whole reversal of all the progress that has taken place. Those people believe that HIV/AIDS has had changes made with HIV/AIDS, and progress has been made because of activism, because of pushing forward the agenda of HIV/AIDS, and because there's been a desire to treat it as distinctive and as very specific to the particular environment that it's in. So consequently, these two groups now are in an interesting debate. But the curious thing that seems to be driving some of the choices that are being made in this debate is that it would seem as if the World AIDS Support Organizations, many of whom began the AIDS support process by giving funds to organizations and to outfits, have begun to assess the work that they've been doing over the years and have determined that if HIV/AIDS is not treated as just one of the many kind of ailments that affect people in poor countries, that ailments like malaria, tuberculosis, and all of these other things, then HIV/AIDS support may be diminished over the time. Consequently, it makes sense that those organizations that are at the mercy of these larger organizations, that is the home organizations living in the countries where this work is being done, will have to adapt and change their view and change their approach so that it meets the needs of these higher heads of thinking. But it's a tough question, because the question is, has progress been made enough such that an emphasis on HIV/AIDS and its unique qualities and its unique nature can be ignored or can be not paid attention to, so that a wider cross-section of needs are dealt with? Have we made enough progress in terms of removing stigma to make that possible? And the jury is really out on that question. But those are the two fundamental questions that are being asked here in Haiti. And those questions are more acute because the people who are arguing for a unique view of HIV/AIDS are the people living with the disease. They are the people who are actually living with the disease and facing all the discrimination and all the stigma that surrounds them. And the people, tellingly, who are arguing for an expansion of the view of how health is approached are those who are not necessarily living with the disease, but who have committed their life to working in the area of the disease. So the question is it that those who are living with the disease have an overblown sense of what is important, or do they have a more accurate sense of what is important? And are those who are leading the charge and the work that is being done in HIV/AIDS, and who have been really at the center of much of the work that has made so many changes in terms of HIV/AIDS in Haiti over the years, are they misguided, or are they missing the point, or are they a little too optimistic about the environment in which they work? Or, and finally, are they being simply pragmatic as a way to make sure that they can continue to get funding? It's a great question, and we'll see how that progresses as we go through life here with HIV in Haiti.